The Canadian Charter of Rights and Freedoms right now is being severely violated to an extent I would have found hard to believe in March, when I thought there was going to be a short-term temporary lockdown just for the purposes of flattening the curve. Does anybody remember that from 8 months ago? And it seems that curve's never going to be flat. These restrictions are now effectively becoming permanent. I spoke with one of the MLAs this past Wednesday morning and was told that, you know, we have to, we can't protect vulnerable seniors in long-term care facilities. That's just impossible, because then we'd have to require staff to live there, 24 hours a day. And so we can't protect those seniors. Therefore, we have to lock down all of society to slow down the spread. And I found that frightening, because that suggests, there's always going to be vulnerable seniors in long-term care homes. So that suggests lockdowns forever, because there's always going to be this risk. But we're fighting back. We are right now, right here, this time, this place. We are exercising our freedom of expression, our freedom of peaceful assembly, our freedom of association. We are exercising our liberty as citizens. And I'm going to talk about how the Charter applies to the lockdown situation. I'm going to talk about forthcoming court actions. There have been people urging the Justice Centre for months and months and months, when are you going to go to court? When are you going to go to court? When are you going to go to court? And, for good reasons, which I'll get into, we have not done so yet, but the time is coming very soon when the government's going to have to answer some questions, which they're not doing currently. So the Charter's rights and freedoms, the very first one, freedom of conscience and religion, we see that under pretty vicious attack all over the place. There is a CBC story this morning that in Manitoba, the police had blocked off access to a church parking lot because the Manitoba government has deemed it illegal to have a drive-in church service. I guess just another example of evidence-based public policy, because COVID can apparently go from one person in a car through the metal and glass, through the air, and then through the metal and glass into another car. I mean, this is just outrageous that the government is making it illegal to have a drive-in church service where the people come and park their cars on the parking lot and then they all tune into the radio or whatever technology, so they have at least some sense of physical togetherness. Because churches are closed in Manitoba. The church that was blocked off this morning, so the police were there to prevent people from driving into the church parking lot. The church already got a $5,000 fine last week for having an in-person service. Here in Alberta, a few days ago, a man, I think it was Medicine Hat, could have been Lethbridge, given a $292 ticket by a police officer for sitting in his car drinking his coffee and eating his donut. He was gotten the food from Tim Hortons. I don't know if he went through drive-through or walked in, but he's sitting in his car drinking the coffee, eating the donut, and the policeman says, well, you have to get out of here. You have to leave. And, well, why? Well, if teenagers see you sitting in your car drinking your coffee and eating your donut, then, teenagers might start to think that it's okay to hang out like this, and so you have to leave immediately. And the guy got a $292 ticket. This is Alberta, where our Premier Jason Kenney tells us that there is no lockdown. There's never been a lockdown. He said that several times, which I think would come as what planet is he living on if your business has been destroyed, if you're one of the people thrown into unemployment, if you are suffering in isolation, because we all know that Zoom and Skype are no substitute for in-person meetings, which is why it's good that we're here, because the way that we are as human beings is we need in-person interaction. It's a basic human need. Now, it can't be quantified, qualified, explained in how many units of humanity or something. Like, it's kind of hard to calculate, but one of the reasons why the Charter protects freedom of association is that fundamental basic human need to be together in person at the same time, at the same place. Freedom of association is another fundamental freedom in Section 2 of the Charter. It's through freedom of association that we accomplish great things. You think about your favorite charity, or think about several of your favorite charities. They were probably all started by a man or a woman acting alone, wanting to do a great thing, and then they got together with other people, and they created a society, or maybe they incorporated and created a nonprofit corporation, or maybe they didn't do any of that stuff, but they're still a group, and they raise money and they do good things. Where does that come from? Freedom of association. You think of the prosperity that we still have, we've got a good 2/3 of it left. I guess we could be happy with that. But the data, 38% decline in gross domestic product at an annualized rate. The numbers are frightening. I think we've destroyed roughly 1/3 of our economy. We'll be releasing a report. The Justice Centre is releasing a report next week by Friday. It's called Flying Blind, and it's about the lockdown measures and how they violate our charter freedoms. So we have freedom of conscience and religion violated by lockdown measures, freedom of association violated by lockdown measures, freedom of peaceful assembly violated by lockdown measures. In Ontario and perhaps in Alberta, and I'm not on top of this as much as I should be. You'd be better off having one of my staff lawyers here because there's so much happening so fast everywhere all the time. But I know there's at least one province in Canada where it's illegal to have more than 25 people meeting outdoors. Again, we're supposed to have evidence-based public policy, and we know that COVID does not transmit easily or readily outdoors. It would if you're in a tiny room with another person who's got COVID and you're together for 30 minutes, that could do the trick. But outdoors, masks imposed on children. The youngest person in Alberta to have died of COVID was 27, and that was somebody with serious pre-existing health conditions and immune compromise and so on. There's no children that are dying of COVID, contrary to what we were told in March. And I fear that, I've spoken publicly in the last few months, and we've been watching, and 2 months ago, people said, well, should I just disobey and get a ticket? And I said, well, I'm not really sure. We're at a point now where a lot of people are stepping forward and they're willing to say, you know what, I'm going to exercise my charter freedoms. Give me a ticket if you want, arrest me. We're not going to be locked down forever. And if we don't resist, if we don't rise up peacefully, right, no burning buildings and looting and vandalism, that's not part of freedom of expression. Freedom of expression has to be peaceful in order to be legitimate. And if it's not peaceful, it's not valid free expression. So we've got these rights and freedoms in the Charter: conscience, religion, peaceful assembly, association, life, liberty, security of the person. And the Charter also provides narrow grounds when, in special circumstances, governments can violate these rights. But Section 1 of the Charter says, the Canadian Charter of Rights and Freedoms guarantees the freedoms set out in it, subject only to such reasonable limits prescribed by law as can be demonstrably justified in a free and democratic society. So what that means is any time that the government passes a law or a health order, that's a form of law, not passed by the legislature, which is another problem I might get into later. That's apart from the Charter, we've got huge problems where an unelected, unaccountable doctor is inflicting massive destruction on our economy and our mental health, psychological health, and physical health, and canceling surgeries and inflicting all this damage. And there's zero accountability because these laws are not even properly passed by the legislature of Alberta. That's a whole separate issue. That's apart from the Charter. So basically, the Charter says if a government wants to violate rights and freedoms, it's got to meet 4 tests, okay? First one is that it has to be aiming to tackle a serious problem a pressing and substantial concern. That's the first one. Secondly, the charter violating law has to be rationally connected to the goal. Okay, something that's obviously completely absent with any government that bans drive-in church services, right? There's no rational connection between violating that charter freedom to assemble, to associate, to worship. That freedom is being violated. It's not even rationally connected to stopping the spread of COVID. Again, unless the virus can, jump from car to car. So that's the second part. The government has to show that there's a rational connection. Thirdly, the violation has to be as small, as narrow as possible to achieve the goal. So these huge, broad policies that just have a very destructive impact on so many people, they're not narrowly tailored to get to that objective. And the fourth part, and I think this is the biggie, the onus is on the government to show that lockdown measures are actually doing more good than harm. It's not up to us as citizens. We don't have to prove that the lockdowns are doing more harm than good. There's no onus on us to prove that. The moment our charter freedoms get violated, immediately there's an assumption there that it's bad, it's wrong, it's unacceptable. The onus is on the government to prove that lockdown measures are actually saving more lives than the number of people that are getting killed by lockdown measures. And I'll be getting into that a little bit later. So I'll go through those four, and like I said, the time has come to take the government to court, and that will be happening in the weeks ahead in at least one province. I don't know how many provinces will get actions started in before Christmas. Maybe we'll squeeze in the last one on Christmas Eve or something, and just to wish the government a Merry Christmas with a lawsuit. But so on the first test that the government has to meet, pressing and substantial concern. We had a situation in March where Dr. Neil Ferguson of Imperial College warned the world that millions of people would die of COVID-19. We were also told that it was a threat to everybody. Young adults, children, middle-aged, everybody should be very, very afraid of the virus. We were also told that large numbers of younger people would suffer permanent health damage. So you'd have all these 30-year-olds walking around who had the lungs of a 50-year-old because of this permanent health damage that many, many young people were going to suffer. Dr. Neil Ferguson has been quite famous over the years. He has made wildly inaccurate predictions about bird flu, about swine flu, about BSE, the mad cow disease. And every time he's warned that there's going to be hundreds of thousands of people or millions of people that are going to die. And then the actual result is that it's 1% of 1% of 1% of his predictions. So why any politician continues to listen to Dr. Neil Ferguson, why they would have listened to him in March when he's got a proven track record of making wildly exaggerated and completely inaccurate predictions, why they listen to him, I don't know. I'll just try and assume the best of intentions. People generally have good intentions when they do things, so I don't question the sincerity of the politicians and chief medical officers who are violating our rights and freedoms. In their minds, they think that they're doing a good thing. No point in getting into motives, but we certainly can get into facts and data and statistics and take a hard look at the results and the consequences without questioning those motives. So where are we today? November, so we're 8 months later. The COVID-19 has not claimed millions of lives around the world. The latest data is on a website called Worldometer. Worldometer is like world-o-meter. Worldometer collects and gathers the statistics from different countries and provinces and states and amalgamates them. And according to Worldometer, 1.4 million people have died of COVID. Now, we need to put that into proper context, something the media consistently fails to do. Every year in the world, there are about 55 million people that die every year. So we've got 1.4 million COVID deaths and 53.6 deaths from other causes. So that's not to minimize the significance of it. I mean, every death is tragic. One of the hardest things I ever went through in my life was when my grandmother died, and I was 21 years old. It was horrible. It was crushing. It was devastating. She was like a mother to me. And so every death is sad, and the COVID deaths are sad. And, so are the other 98%, 99% of deaths from other causes. They're all sad. That's not the point. And I say this because you get these ridiculous attacks that when you try to take a hard-headed look at facts, and facts don't care about feelings, do they? You try to take a hard look at the facts and the evidence and the data, and then people accuse you of being callous, which is just, it's ridiculous, and it's vicious, and it's unwarranted. So we were told in March, COVID is an unusually deadly killer. We've been told it's a pandemic. Well, traditionally, pandemic meant it was worldwide, and it was a very serious illness. Pan comes from the Greek word for all, right? So the moment something is all over the world, it's a pandemic. But when you look at the previous pandemics, you had the Spanish flu, 1918 to 1920, which killed between 20 million and 50 million people at a time when the world's population was a little bit more than a quarter of what it is today, right? So you have 2 billion people. Today it's 7.8 billion. So you get a little bit more than a quarter of the world's population. And this virus kills 20 to 50 million people over a 2-year period. Many of them were healthy young adults. Typically, the Spanish flu was different from the annual flu. The annual flu every year kills people under 5 and people over 75, right? You may have heard like the horrible, a young child, 1, 2, 3, 4 years old gets the flu. Children die of the flu. There's no children dying of COVID. But the Spanish flu was different. It killed people in their 20s, 30s, and 40s, healthy adults. And there were people that got it and they were dead within 24 hours. It was just a vicious, vicious killer. It decimated. You could look at the actual reductions in population of countries after the Spanish flu. There's an actual decline, lots of orphans. So that was 1918. And Jason Kenney has actually compared COVID to the Spanish flu on several occasions publicly. Makes a comparison. I mean, it's just insane. It's a disregard for reality. So COVID's nothing like the Spanish flu. What we have now, the data, and the 1.4 million purported deaths that you find on Worldometer, we have to take into account the fact that public health officials have stated publicly in many jurisdictions, not all, that anybody who dies with COVID in their body is deemed to have died of COVID. That's not my opinion. That's public health officials have stated that publicly. We've got our website, www.jccf.ca. We've got papers there and all the quotes and references. You can look up the links. So these numbers, and again, I'm not imputing malicious intent, but when you've got a common practice in many countries that anybody that dies with COVID in their body, right, people in hospices, right, you only go to a hospice if a doctor said, like, you're absolutely, definitely, terminally ill, you're going to die, and so you go to a hospice where they give you palliative care to keep you comfortable, but they're not trying to save your life because you're going to die. So we have, we have deaths in hospices that are being written off as COVID deaths. So the numbers are probably a lot higher than what they actually are. Even Alberta Health Services, you go to their websites and you look at comorbidities or pre-existing illnesses. In Alberta, 97.5% of the people that have died of COVID, which sadly now is at close to 500, give or take, very sad. The other 26,500 deaths of people dying from other causes are also sad. So here in Alberta, 97.5% of the COVID deaths are with people with 1 or 2 or 3 comorbidities. 96% of the deaths are amongst people ages 60 and over. Fully 3/4 of the COVID deaths in Alberta are with elderly people that have 3 or more illnesses like cancer, heart disease, emphysema, diabetes, high blood pressure, 3 or more. That's 75% of the COVID deaths are people with 3 or more very serious illnesses. And a term that hasn't been used much in the last 8 months, but it was more in common usage amongst medical scientists and infectious disease specialists, was years of lost life. So when you look at cancer or car accidents or suicides or a flu virus or whatever, you look at years of lost life, like what kind of an impact is the virus having on life expectancy? Which again, some would say, oh, that's cruel, that's callous. It's like, well, no, it's significant to know what is the impact on life expectancy. So again, we're told in March that this is an unusually deadly killer. And on that basis, I venture to guess most of the people in this room, it's like, okay, well, we're going to have this lockdown to flatten the curve. Okay. If you go to the Justice Centre website, you're not going to see any news releases in March or April that are, calling for an end to the lockdowns. There was a lot of fear. We didn't know facts. Today, we know a lot of facts. It's just, I don't think they're being looked at when our laws and policies are being developed. We know today that COVID is not an unusually deadly killer. And again, that's not my opinion, that's the government's data. Any data, statistics I refer to tonight, I'm getting it off of government websites, not going into any other non-government website with whatever. I'm looking at Alberta Health Services data. I would encourage you to do likewise. The numbers make things pretty clear. So on that very first point in a court action, the government would have to demonstrate that COVID-19 is an unusually deadly killer, and they should face an uphill battle in that when you look at the actual data. That yes, it's tragic. Yes, it's very dangerous for roughly 10% of the population. If you're over 70, if you've got pre-existing health conditions, and you could be 30 or 40 or 50, and if you're immune compromised, okay, so 10% of the population, this is a serious threat. You need to be careful. You need to protect yourself. It's a good friend of mine who's in his mid-70s, and I had coffee with him in the summer, and we sat outside 6 feet apart, no handshake, and because he knows, and he says, like, John, I'm scared of COVID because he's in his mid-70s and he's got like a lung condition, and he's got other stuff. He's in decent health, but he's not in great health. He believes that if he gets COVID, he's probably going to die, and he's probably right. So we have coffee, we have 6 feet apart, and and met with him in September as well. It was still warm enough, and we sat outside. So, second point that the government has to prove: rational connection. This is where my MLA told me a few days ago, we have to force the kids to wear masks at school in order to protect grandma. Well, we all know that even if masks work, and I know a little bit about that debate, I'm not going to get into it. I'm not the expert on masks and how well they work or not. But even if masks work, that's not a good enough and even if social distancing works, that's not a good enough of a guarantee if you love your grandmother and if she's in her 70s or 80s and she's vulnerable and she's got health conditions. So what does that mean? At the end of the day, the only way to protect grandma from COVID is to either say, we're going to connect with you only by Zoom and Skype and phone. We're not going to visit you in person. Or if we visit you in person, it's going to be outdoors and we're going to be 6 feet apart. And we're going to, no hugs, no handshakes, we're going to wear a mask. That's how you protect grandma. Forcing tens of thousands of school children to live in a state of constant fear by having to wear masks and being told that the children are being told that they're vile, dangerous creatures that, should kind of be ashamed of themselves just for being alive. That's the message that is going out to our children. And I fear for 5 years from now, when the reports come out on a massive psychological harm and mental harm imposed on children, because they have to live in a constant state of fear. And the masks promote that fear, they perpetuate it. But forcing the kids to wear masks is not going to protect grandma. Why? Because the only way to protect grandma is actually protect grandma. Don't don't be in a confined space with her for an extended period of time, or maybe don't meet with her indoors, or don't meet with her at all. Do a Skype, Zoom, telephone thing. So there's no rational connection between these lockdown measures. And increasingly, doctors are coming out of the woodworks. Initially, the past 7 months, we've had, the narrative dominated by some doctors. Who's heard of the Great Barrington Declaration? Okay, right on. Worth looking up, worth reading. Barrington, spelled as it sounds, Barrington, the Great Barrington Declaration. 45,000 medical doctors, immunologists, virologists, infectious disease specialists, public health experts have signed on to the idea of focused protection. And the point that they make, and this is still in many of the textbooks, is that you cannot stop a virus from making its way through society. You can, however, protect the vulnerable. And I've asked my MLA, I've asked other people, can you give me one example in human history of a country, a state, a province, a territory, a society, a civilization that completely stopped a virus from making its way through? And there's no historical example, which means that the lockdowns are, by definition, they're not scientific. They are an experiment, that's for sure. Very large political, social, psychological experiment. But if you can't point to a single jurisdiction in human history that actually succeeded in stopping the spread of a virus, then this is again, it's an experiment. The measures are supposed to. The government has to prove in court that the measures are narrowly targeted. So, in other words, the government has to violate our charter rights and freedoms as little as possible in order to achieve the objective. And I don't think that's happening. And the fourth point, most important one, the government has to prove that the lockdowns actually do more good than harm. The onus is on them. So what good have the lockdowns done? Well, I've asked people, how many lives saved by the lockdowns? And the answer is, well, nobody has any idea. You can speculate, and maybe they have saved lives. How many people have the lockdowns killed? In our report coming out next week, Flying Blind, we go through just some of these. I mean, if you wanted to do a comprehensive book on lockdown harms, and I believe they will be written over the course of time, but they're going to be big, fat, thick books, and a lot of the data is just not there yet. So, if you're trying to prove lockdown harms, a lot of what you're doing is, well, it stands to reason that if you cut off people from their family and their friends and their sports teams and connecting with their buddies at the pub and their basketball and their hockey and their church and their 12-step program, and you force people into isolation for months on end, what's that going to do to suicides? Well, we don't have the hard data, and it'll be a long time before it comes in. But on the government side, they've been operating on pure speculation for the last 8 months. So this might happen, and this might work, and this might do some good. Everything is speculation. But the data that's coming in is suggesting that the lockdowns have caused a lot more harm than good. Just a few examples. One thing that's interesting is that deaths in Canada in the first 8 months of the year were not down. They were down, not up. Okay, you wouldn't have said that after the Spanish flu made its way through your society. You'd actually see, a huge number of deaths. So the deaths in the first 8 months of 2020 was 186,000 deaths. Previous year, January to August, was 190,000 deaths in Canada. So small drop in deaths. The other data that we are releasing in our paper is that the deaths for cancer and heart disease and stroke and pneumonia and influenza, all of those, the deaths are down by a total of roughly 11,000, but now we have 11,000 COVID deaths. And this ties in earlier with the reporting. So we don't have the massive deaths that you would expect and should expect from a real pandemic like the Spanish flu that we should actually be afraid of. If there was a Spanish flu, we shouldn't be having this meeting, right? But COVID-19, again, it's harmless to 90% of the population, and it's a serious threat to 10% of the population. The 10% of the population, nobody's forcing them to go eat in a restaurant, go to the gym, go to a political rally, go to church. People can protect themselves, like what my friend does when we connect over coffee and we don't shake hands and we sit 6 feet apart outdoors, right, to protect him. That's the real protection. That's how you protect grandma. Canceled surgeries, 200,000 canceled surgeries. This led to the death of Jerry Dunham, age 46, in Medicine Hat. In June, he died 2 weeks before Father's Day, leaving behind 2 grieving daughters, ages 6 and 8. Jerry Dunham had his heart was operating at 25% capacity. He needed a pacemaker. But Dina Hinshaw and Jason Kenney decided that his pacemaker surgery was not essential, and he didn't get his pacemaker surgery, and he couldn't work. And he was terrified because he was looking at what was happening in Ontario in the month of May. There's an Ontario Health Network that released data that 30 cardiac patients had died because their surgery was canceled. 30 deaths. And the response of Ontario's health minister was to proclaim with great enthusiasm that they're saving thousands of lives. She's quite happy with the government policies. And I'm in touch with the mom of the 2 girls, and she said it was the most horrific thing that Jerry saw this data, and he wrote on his Facebook page, he wrote, "I hope that I won't become a statistic," because he was in the same boat as these 30 cardiac patients in Ontario who died because their surgery was canceled because of the lockdown. Sadly, he did suffer a heart attack. And by the time paramedics arrived and took him into the ambulance, it was already too late. He was brain dead. He was taken to the hospital. And Krista, the mom, said it was the most horrific scene that she'd ever witnessed in her life, with one of the girls shaking her father and saying, "Wake up, Daddy, wake up, Daddy." And the other girl rocking herself back and forth on the floor. This is what lockdowns are doing when you cancel surgeries to make room for this enormous wave of COVID patients who never arrived. So you've got canceled surgeries. I have asked, this is the worst part, I have written to every provincial health minister in Canada, and I've asked the questions, how many surgeries were canceled in your province? What kinds of surgeries were they, how many were heart surgeries? How many were cancer surgeries? How many were orthopedic? How many were this? How many were that? How many surgeries did you cancel? What kind? How much of each kind? How many of these people have died? How many of these people have suffered permanent health damage? No answers. No answers. And this is the government's obligation. If you're going to violate our charter rights and freedoms, if you're going to deny health care to people in order to save lives, it's a little bit counterintuitive would be a polite word. If you're going to cancel all these surgeries, why can't you at least follow up? And it's not like they don't have the resources. I mean, Alberta, for example, has 20,000 civil servants, and that excludes the policemen, doctors, nurses, teachers, firefighters, social workers, excluding all those frontline services people. There's 20,000 civil servants. So surely they have the resources to follow up on the 22,000 patients and how many died and how many have suffered permanent health damage. How many of the surgeries have been rescheduled? In Ontario alone, in a 2-month period, there were 800 women scheduled for breast cancer surgery. Canceled. Now, I'm not a doctor, but you don't need to be a doctor to know that cancer spreads and you need to get rid of it as soon as possible. And if you've been designated as eligible or as requiring breast cancer surgery, you can be darn sure that you need it. Right? They call these services elective, very misleading term. the accurate term would be non-emergency, right? If you need breast cancer surgery, maybe you don't need it right now this minute, but it's still very urgent and it's medically necessary. And so 800 women in Ontario that had their breast cancer surgery was canceled. I sincerely hope that all of them were rebooked. But how many of those women died? Because then they went for, if the cancer is already spreading everywhere and you have breast cancer and you've already been on a waiting list for the breast cancer surgery and now it gets delayed by 2 months, I hope they all lived. I hope the surgeries were successful, but it wouldn't surprise me if some of those women died because the lockdowns canceled the surgeries. We have delayed diagnosis. 500,000 Canadians, 500,000 people had a delayed in diagnosis. Diagnosis is crucial, especially with cancer. I'm not saying all 500,000 were diagnosed for cancer, but you got to catch the cancer as soon as possible. You don't want a 2, 4, 6, 8 month wait to get your diagnosis. So in our report, we cite all the sources. We estimate that as many as 18,000 Canadians have died of cancer, in preventable, avoidable cancer deaths. 18,000 people have died because of delayed diagnosis, right? Which is COVID deaths, also very sad. I'm not saying one's more sad than the other. 11,000. Suicides. There's correlation between unemployment and suicide. Documented. There are reports on this. So the unemployment rate in Canada spiked up to 13 point something percent. Hopefully it's coming down a little bit. We've destroyed 100,000 businesses at least, and that number is probably going to grow because there are businesses that are just hanging on by a thread that are going to go bankrupt in the weeks and months ahead. And in many cases, this is a person's retirement savings, right? Not everybody's privileged enough to work for the government and work in the public sector and have a nice big pension. There's a lot of people, your business, you build it up, and then you hope that, when you're 55 or 60 or 65 or 70, whenever you want, that's your retirement fund. You hope that you're going to sell your business and sell it for $1 million or $2 million or $5 million or $500,000, whatever. That's your retirement. So when government comes along and destroys your business, they're destroying people's retirements. So increases in suicide because of rises in unemployment, looking at 600 additional suicides in Canada based only on the unemployment. I shudder to think how many other suicides from people that are forced into isolation, that are cut off from friends, cut off from families, deprived of human contact, being relegated to this Zoom, Skype, very poor substitute. And don't get me wrong, I mean, Zoom and Skype are, they're great inventions. A good friend of mine was transferred by his company, lived in Scotland for 2 years, and then got transferred to Dallas. And we kept in touch by Zoom and Skype, and that was wonderful. But you know what? When he lives in Calgary, and he came back to Calgary, we don't Zoom and Skype. There's no substitute for getting together with a friend in person. And the people that get hurt by this are the vulnerable, marginalized people that are already maybe not enjoying good mental health. If you're really strong, if you're really good mental health, physical health, spiritual health, psychological health, you can probably handle some of this isolation stuff not too badly. But there's a lot of people who don't have that strength. They need to be in person at their 12-step recovery meeting. They need to connect with people in person at church. They need to connect in person with their friends at a pub. They need to be part of that basketball team, that hockey team. You take that away, it's the vulnerable people that are going to get hurt the most. We're going to see massive increases in mental health disorders, psychiatric disorders, and suicides. And again, we don't have that data yet. But if somebody from the government were here saying, you're just speculating, I'd say, well, what have you been doing the last 9 months or 8 months? Just speculation. Maybe. Drug overdoses. In British Columbia, 52% increase in drug overdose deaths in in the first 8 months of the year. So January to August, 1,068 deaths in British Columbia from drug overdoses. COVID deaths in the same period at 208. So the drug overdoses are killing 5 times as many people as COVID-19. Similar stats from other provinces. So these lockdowns are, they're causing massive harms. And again, our paper only tackles the canceled surgeries, the delayed diagnosis, like delayed MRIs and CT scans, suicide and drug overdoses. We're only tackling 4. There's another 20, 30, 40, 50 different factors, that need to be studied. So I guess the big question is, what can we do as citizens? And I think first and foremost, we need to do exactly what we're doing right here, right now, tonight. We need to exercise our charter rights and freedoms. Your freedoms are like a muscle, okay? The more you exercise it, the stronger it becomes, right? If you sit on the couch all the time and don't exercise, like all of your muscles are going to weaken and your health is going to decline, right? But if you exercise, you play sports, you go to the gym, whatever, the more you exercise, the stronger your muscles are. Our freedoms are the same way. If we don't exercise our freedom of expression, freedom of association, freedom of peaceful assembly, freedom of conscience and religion, if you don't exercise those fundamental freedoms, then they're going to get weaker and weaker. We've certainly seen a weakening on freedom of expression, which is something the Justice Centre is very involved with. I won't get into it too much tonight, but people are moving away from exercising freedom of expression because people get intimidated by vicious name-calling, because if you come up with a politically incorrect opinion, you're going to get called a racist, and you're homophobic, and you're a bigot, and you're a misogynist, you're a sexist, you're this, you're that. And, it's unfortunate, because when you allow yourself to get intimidated and don't exercise your free speech rights, that's when the sphere of permissible speech gets smaller and smaller and smaller. Eleanor Roosevelt, wife of President Roosevelt some decades ago, said, "Nobody can make you feel inferior without your consent." And I would take that saying, which I think is very true, and I would say, nobody can intimidate you without your consent. And so it's important, when you exercise the free speech rights, do not allow yourself to get intimidated by name calling. Just shrug it off and, take it as a compliment, because when people engage in name calling, it means they do not have any intelligent response to your argument. So look at it as a compliment. But there's an example. We have to exercise our free speech rights and not be intimidated by name calling. So that's very important. Being actively engaged in the democratic process is also extremely important. And I would say that I know many of you have emailed your MLAs. It's good if you did. Take it to the next level and ask for a meeting. And they'll probably say, well, we're not meeting. And it's okay, well, then I'd like a phone call. Phone your MLA, talk to your MLA, talk to your neighbors. The Justice Centre is getting a lot of calls from people, what can we do, what can we do? And we're going to put together a brochure, and we're going to make that available that, well, for one, you can print it off of the website, but also just print the hard copy brochures and just mail them out to people and say, give you 50 brochures, go take a walk in your neighborhood and put them in mailboxes and get the word out that way about charter rights and freedoms and about the lockdowns doing more harm than good. We're being inundated with calls from all over the country. People are saying, should I just stand up for my rights and freedoms and accept a ticket? And, 8 months ago, 6 months ago, 4 months ago, even 2 months ago, it was kind of like, I wasn't really sure how to answer the question. We're at a point now where we're going to represent people when they get a ticket, and they can contact us. And I hope we're just going to clog up the court system with a whole bunch of not guilty pleas, because we're at a point now, if we don't speak up now and stand up now, these lockdowns are permanent. They're permanent. We have to reverse what is permanent, because the whole flattening the curve thing, and that's not based on evidence either. The whole fear-mongering with the so-called cases. There are medical doctors and infectious disease specialists who point out that these tests are not accurate and they're not reliable. And we know that to be true because when the media report on 10,000 cases in Alberta, yet only 300 COVID patients in hospital. I mean, 97%, depending on which product, 95%, 97%, 99% of these so-called cases are perfectly healthy people. And the media is not, they're not necessarily lying, but they're doing something that's very misleading, which is to not report relevant data that you ought to report on, right? So when you get a screaming headline, 11,000 Canadians have died of COVID, yes, that's true. And it's important to remember that every year, 300,000 Canadians die. And all 300,000 deaths are sad and tragic. So you have 11, but they don't talk about the other 289,000 deaths. That's just not mentioned. They say our healthcare system is in danger of being overrun. So you hear about 200, 250, 300 COVID patients in hospital. What does the news story not say? You know how many hospital beds we have in Alberta? 8,500. So you've got the COVID patients are using 3% of Alberta's hospital beds. And this is why we all have to give up our rights and freedoms. The other big question that I don't see any politician stepping forward to answer is, why don't you create more hospital beds? It's a fact. There are numerous studies and reports, Organization of Economic Development and Cooperation, think tanks. Canada's got one of the highest, it's first or second place in healthcare spending, and yet on outcomes, number of doctors, per capita, number of nurses, number of hospital beds, number of ICU spaces, number of MRI machines, number of CT scan machines, waiting lists. On every metric, Canada's coming in 7th, 14th, 21st, 5th, 11th, but we've got the spending way up there. So the assumption seems to be that we're spending every healthcare dollar wisely and efficiently, and we just have no choice but to lock down the whole population. I mean, it's ridiculous. There's no reason to not expand the number of hospital beds if that's required. But again, when we're at 250 of 8,500 hospital beds being used for COVID patients, the healthcare system is not in danger of being overrun. And I had one doctor challenge me on that by email, and I appreciate it. I'm in touch with about 20 doctors and talk with them regularly. And he said, well, you're not taking account into, the spread and the multiplier effect. The fact is that the COVID deaths in Canada peaked in April and May. They dropped off sharply in June, and then July, August, September. And so the virus has made its way through society. And it's not likely that we're going to see another spike of deaths. But if we do, I think that the healthcare system should be our servant and not our master. So what do? We exercise our rights and freedoms, active in the political process, contact your MLA, and get the word out, share things, share the Great Barrington Declaration with your friends and family. Send it out there. Yeah, some people will get upset, don't you realize you're killing people? Shame on you. Hey, it's okay, right? We can't let that kind of feedback, if we love our freedoms, you can't be deterred by some harsh and negative feedback that you're going to get from time to time.